In this video, we will explore the top 25 behavioral interview questions commonly asked in NHS interviews. Understanding these questions is essential for candidates looking to succeed in their application process. We will also provide well-crafted answers to help you prepare effectively. This guide aims to boost your confidence and improve your chances of securing a position within the NHS. 1. Tell me about a time when you demonstrated compassion in your work. In my previous role as a nurse, I encountered a patient who was experiencing significant anxiety before surgery. I took the time to sit with her, listen to her concerns, and provide reassurance. I explained the procedure in simpler terms and addressed her fears. This personal interaction helped her feel more at ease. After the surgery, she expressed gratitude for the support and compassion I showed her during such a vulnerable moment. This experience reinforced the importance of empathy in healthcare and its impact on patient outcomes. 2. Describe a situation where you had to handle a difficult or angry patient. How did you respond? When I encountered an angry patient who felt neglected during their wait, I approached them calmly and empathetically. I acknowledged their frustration and actively listened to their concerns without interrupting. After understanding their issue, I apologized for the inconvenience and assured them that I would do my best to address their needs promptly. I involved them in the process by explaining the steps I would take to expedite their care. By maintaining a respectful and compassionate demeanor, I was able to de-escalate the situation, ultimately leading to a positive resolution. 3. Give an example of when you went above and beyond to provide excellent patient care. In my previous role, I encountered a patient who was anxious about an upcoming surgery. Recognizing her distress, I took extra time after my shift to sit with her, listen to her concerns, and explain the procedure in detail. I also coordinated with the surgical team to ensure she received a personal call the day before her surgery, offering reassurance and answering any last-minute questions. This personalized approach not only alleviated her anxiety but also fostered trust, ultimately enhancing her overall experience and satisfaction with our care. 4. Tell me about a time you had to work effectively as part of a multidisciplinary team. In a recent project, I collaborated with nurses, physicians, and physical therapists to develop a comprehensive care plan for a patient recovering from surgery. Regular meetings allowed us to share insights and updates, ensuring everyone was aligned. My role involved coordinating communication between team members and addressing any concerns promptly. This collaborative approach led to improved patient outcomes, as we were able to tailor interventions effectively. The experience reinforced the importance of teamwork in delivering holistic care and highlighted the diverse strengths each professional brings to the table. 5. Describe a situation where you had to deal with a challenging colleague. How did you handle it? In my previous role, I encountered a colleague who frequently dismissed others' ideas during team meetings. This behavior created tension and stifled collaboration. I decided to address the issue by having a private conversation with them. I expressed my observations and the impact their actions had on the team's morale. I focused on specific instances and encouraged them to share their perspective. This led to a constructive dialogue, and we agreed on strategies for more inclusive discussions. Over time, their behavior improved, fostering a more supportive team environment. 6. Give an example of how you have upheld patient confidentiality in a difficult situation. In a busy emergency room, I encountered a situation where a patient's family member loudly demanded information about their relative's condition. Recognizing the need to uphold patient confidentiality, I calmly explained that I could not share any details without the patient's consent. I guided the family member to a private area to discuss their concerns, assuring them that I would relay their questions to the medical team. This approach not only protected the patient's privacy but also helped the family feel heard and respected during a stressful time. 7. Tell me about a time you had to prioritize multiple urgent tasks. How did you approach this? In a busy shift, I faced multiple urgent tasks. A patient needing immediate medication, another requiring assistance with a procedure, and a colleague calling for help with a family consultation. I quickly assessed the urgency and impact of each task. I delegated the family consultation to a nearby nurse, ensuring they were briefed. Then, I administered the medication and assisted with the procedure, prioritizing patient safety and care. Regular communication with my team helped maintain focus and efficiency, allowing us to manage all tasks effectively without compromising care. 8. Describe a situation where you identified a potential safety risk. What actions did you take? In one instance, while conducting routine checks, I noticed that a medication storage area was not adequately secured, potentially allowing unauthorized access. Recognizing the risk this posed to patient safety, I immediately reported the issue to my supervisor. I then collaborated with the pharmacy team to implement a new locking mechanism and improved signage to raise awareness. Additionally, I organized a training session for staff on the importance of medication security, ensuring everyone understood the protocols. This proactive approach helped prevent potential mishaps and enhanced our safety standards. 9. Give an example of how you have promoted equality and diversity in your work. In my role, I actively promoted equality and diversity by organizing awareness workshops for staff and patients. I collaborated with local community groups to ensure representation and feedback from diverse populations. Additionally, I encouraged open dialogues about cultural competencies during team meetings, where we shared best practices for inclusive patient care. Implementing a mentorship program for underrepresented staff also helped foster a supportive environment, ensuring everyone felt valued and empowered to contribute their unique perspectives in our healthcare setting. 10. Tell me about a time you had to communicate complex medical information to a patient or family member. When I had to explain a new diagnosis to a patient and their family, I focused on simplifying the information. I used analogies to relate the medical terms to everyday experiences. I encouraged questions and took my time, ensuring they understood each point before moving on. Visual aids helped clarify complex concepts, making it easier for them to grasp the treatment plan. Their relief was evident as they expressed gratitude for the clear communication, which ultimately empowered them to make informed decisions about their care. 11. Describe a situation where you had to adapt quickly to unexpected changes in your work environment. In my previous role, I encountered a sudden staff shortage due to illness during a busy flu season. With patients pouring in, I quickly reassessed our workflow and collaborated with remaining staff to streamline processes. We divided tasks based on each person's strengths, allowing us to maintain efficiency despite the reduced numbers. I also communicated proactively with patients, informing them of potential delays and ensuring their concerns were addressed. This experience reinforced my ability to adapt, prioritize, and lead under pressure, ultimately ensuring that patient care remained uninterrupted. 12. Give an example of how you have contributed to improving a process or procedure at work. In my previous role, I noticed that patient discharge times were often delayed due to inefficient paperwork. I initiated a project that involved collaborating with nursing staff and administrative teams to streamline the discharge process. By implementing a digital checklist, we reduced the paperwork needed and ensured all necessary information was available before discharge. This not only improved efficiency but also enhanced patient satisfaction as they spent less time waiting for their release, allowing for a smoother transition to home care. 13. Tell me about a time you had to handle a highly stressful situation at work. How did you manage it? In a busy emergency department, we faced an unexpected surge of patients due to a local accident. The atmosphere was tense, and everyone was under pressure. I quickly assessed the situation, prioritized patient care based on severity, and delegated tasks to team members. By maintaining clear communication and keeping the team focused, we managed to triage effectively. I also took a moment to check in with my colleagues, offering support and encouragement. This approach helped us navigate the crisis while ensuring that patients received timely care. 14. Describe a situation where you had to use your problem-solving skills to overcome a challenge. In a previous role, I encountered a situation where a patient's medication was missing due to a pharmacy error. The patient was experiencing severe symptoms and urgently needed the medication. I quickly assessed the situation, contacted the pharmacy for clarification, and learned that the order had been misplaced. I collaborated with the pharmacy staff to expedite the refilling process while simultaneously providing the patient with alternative care options to manage their symptoms in the interim. By proactively addressing the issue, I ensured the patient received timely care and remained informed throughout the process. 15. Give an example of how you have demonstrated leadership in your role. In my previous role as a charge nurse, I identified that our team was struggling with patient handoffs during shift changes, leading to communication gaps. I organized a workshop where we collaboratively developed a standardized handoff protocol. This initiative not only improved clarity but fostered a culture of teamwork. I also mentored junior nurses by encouraging them to take lead roles during patient rounds, empowering them to voice their insights. This approach significantly enhanced our team's efficiency and cohesion while ultimately benefiting patient care. 16. Tell me about a time you had to handle a complaint from a patient or family member. I once received a complaint from a family member who felt their loved one wasn't receiving adequate attention. I listened carefully to their concerns, acknowledging their feelings and assuring them that patient care is our priority. I took the time to investigate the situation, spoke with the nursing staff, and ensured that appropriate measures were taken to address the issue. I followed up with the family to provide updates and reassure them about the care being provided. By demonstrating empathy and maintaining open communication, I was able to restore their trust in our team. 17. Describe a situation where you had to motivate a demoralized team or colleague. In a challenging project, my team was feeling overwhelmed due to tight deadlines and increasing workloads. I organized a meeting to openly discuss their concerns and acknowledge their hard work. Together, we identified specific issues affecting morale, and I proposed a plan to redistribute tasks more evenly. I also celebrated small victories to boost spirits and encouraged team members to share their ideas. This approach fostered collaboration and renewed enthusiasm, ultimately leading to improved performance and a more positive work environment. 18. Give an example of how you have shown initiative in your work. In my previous role, I noticed that the patient intake process was time-consuming and often led to delays in care. Taking the initiative, I proposed a digital solution to streamline the process. I researched various software options and presented my findings to the management team. Once approved, I led the training sessions for staff to ensure everyone was comfortable using the new system. As a result, we reduced wait times significantly, allowing us to serve more patients efficiently. This experience taught me the value of proactively identifying areas for improvement and taking action. 19. Tell me about a time you had to deal with a difficult ethical dilemma. In my previous role, I faced a situation where a patient requested to be discharged against medical advice despite the risks involved. I had to balance respecting the patient's autonomy with my responsibility to ensure their safety. I took the time to listen to their concerns, providing clear information about the potential consequences of their decision. After discussing their options and the importance of continued care, the patient ultimately agreed to stay for further observation. This experience reinforced my commitment to patient-centered care while navigating complex ethical issues. 20. Describe a situation where you had to manage your time effectively to meet multiple deadlines. In a busy hospital environment, I was assigned multiple projects with overlapping deadlines, including patient assessments and staff training sessions. To tackle this, I created a detailed schedule prioritizing tasks based on urgency and importance. I broke down each project into smaller, manageable steps and allocated specific time slots for each. Regular check-ins with my team ensured everyone was aligned, and we could redistribute tasks as needed. By maintaining open communication and staying organized, I successfully met all deadlines while ensuring high-quality patient care remained a priority. 21. Give an example of how you have continued your professional development. In my role as a healthcare professional, I actively seek opportunities to enhance my skills and knowledge. Recently, I enrolled in a specialized workshop focused on advanced patient care techniques. This workshop not only provided valuable insights but also allowed me to connect with peers and discuss best practices. Additionally, I regularly attend webinars and read relevant journals to stay updated on the latest research and innovations in our field. Embracing lifelong learning has significantly enriched my practice and improved patient outcomes. 22. Tell me about a time you had to admit to and learn from a mistake. In my previous role, I mismanaged a patient's medication schedule, which led to a delay in their treatment. Upon realizing the error, I immediately informed my supervisor and the attending physician. I sincerely apologized to the patient and their family, ensuring them that we would rectify the situation promptly. I took the initiative to create a double-check system for medication administration, involving my team in the process. This experience taught me the importance of accountability and clear communication, ultimately enhancing our team's efficiency and patient safety. 23. Describe a situation where you had to handle a conflict between team members. In one instance, two team members had a disagreement over patient care protocols, which escalated to tension affecting the entire team. I facilitated a mediation session, encouraging both individuals to express their viewpoints and listen actively. By focusing on common goals, patient safety and quality care, we collaboratively identified a compromise that integrated both perspectives. This approach not only resolved their conflict but also strengthened team cohesion, fostering a more collaborative environment for future challenges. The resolution improved communication and trust among team members. 24. Give an example of how you have used evidence-based practice to improve patient outcomes. When working with diabetic patients, I implemented a structured education program based on current research. This program focused on dietary management, blood glucose monitoring, and lifestyle modifications. By utilizing evidence-based guidelines, I tailored the information to meet individual needs, ensuring that each patient understood how to manage their condition effectively. As a result, we observed a significant reduction in HbA1c levels across the patient group, demonstrating improved health outcomes and empowering patients to take charge of their diabetes management. 25. Tell me about a time you had to work with limited resources. How did you ensure quality care was still delivered? In a previous role, our unit faced a sudden shortage of staff due to illness, which strained our ability to provide adequate patient care. I collaborated closely with my colleagues, reallocating tasks based on individual strengths and urgency of patient needs. By prioritizing critical cases and implementing a buddy system, we maintained communication and support. Additionally, I utilized evidence-based protocols to optimize our available resources, ensuring that patients continued receiving high-quality care despite the limitations. This experience highlighted the importance of teamwork and adaptability in challenging situations. In this video, we've explored the top 25 NHS behavioral interview questions and their ideal answers to help you prepare effectively for your interview. Understanding these questions can greatly enhance your chances of making a positive impression and demonstrating your suitability for a role within the NHS. Remember, the key to success is showcasing your experiences and how they've shaped your skills. If you found this content helpful, please give us a thumbs up and subscribe to our channel for more insightful videos. Your support means a lot to us.